Welcome to Brain Chat with the Nerdy Neurologist. I'm Dr. Mitzi Joy Williams, and I'm your board certified neurologist and MS specialist. My mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be talking all things MS, health and wellness, advocacy, and we'll throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Hello, friends. Happy Monday. It's Dr. Mitzi, your board certified neurologist and MS specialist. I am so excited to be here with you all tonight to talk about a topic that is very near and dear to my heart, and that's MS in the Black community. So you guys know how we do on Brain Chat. This is our first Brain Chat of Black History Month, and we're super excited about my amazing guests that are going to be on tonight. You know how we do when we get started. Go ahead and drop in the chat where you are logging in from. I bid you greetings from slightly frigid Atlanta, Georgia. I know that cold is a relative term, but it's cold for us Georgia peaches down here. We've got big coats on and all that good stuff. But again, very excited to be here. We are also grateful for our new sponsor, Janssen. And there is information about MS that's general on moretoms.com. So we're very excited to have them to join the Brain Chat team. I see some folks saying where they're logging in from. Okay, Bowie, Maryland, Houston, Texas, Jacksonville, Alabama. Did I know there was a Jacksonville in Alabama? I think I learned something new tonight. So go ahead and drop in the chat where you're from. Remember that if you have questions, you can go ahead and put them in the chat so that while we're talking, even though we won't answer them as we go through kind of our discussion, we will get to them at the end of the evening. So please don't be shy. Drop some questions in there, all that good stuff. All right. So I see somebody logging in from Chicago. I know it's real cold there. And then Pontiac, Michigan. All right. Awesome. So we got folks from all over the east side. And we just got a west side, San Bernardino, California. Awesome sauce. All right. Well, very good. We're going to go ahead and get started. We've got one of our guests that is here with us already, and we're still waiting for our friend Tyler Campbell to join us. But we're going to go ahead and get started with Dr. Tirisham Gyang. Guys, I am so excited. She is an amazing neurologist at Ohio State. She treats people with MS. She also does clinical research and just hosted an amazing symposium about neuroscience and how we can increase diversity in neuroscience research. So I am going to bring Dr. Gyang up to the stage right about now. All right. Hello there. You're on mute.
Hi.
Hello there. How are you? Welcome to Brain Chat. Yay.
Thank you. I'm really excited to be here. This is my first time here, so I'm really excited.
Okay, awesome. So thank you for coming on with us tonight. We've got a lot to talk about. And, the amazing thing is that, when I first started treating patients with MS, if we did a show like this, we wouldn't have very much to say. We would just talk mostly about what we don't know. But I'm very excited about the different advances that we have, about learning about MS in the Black community and about other ethnic groups. So this is just a really exciting time in terms of research and in terms of advancement. So we got a long way to go, but we have come a super long way. So why don't we start by you telling us a little bit about yourself and how you got into the field of MS and how you started working with different groups of people who have MS.
Definitely. So thank you very much for having me here. As I said, I'm super excited to be here. So I'm Tirisham Gyang, as you said. I'm currently at Ohio State University. And I went into medical school not really knowing what I was going to do, and ended up really enjoying neurology, and went into neurology residency. And then during my neurology residency, I feel like there was one patient in my second year that I took care of that just opened my eyes to MS and things similar to MS. And so I started doing more research. I started to work with the MS doctor. I started to just read a little bit more about MS. And I thought to myself, I was like, this is this is something I should do for the rest of my life. And
Wow.
so I ended up doing a fellowship in MS. I did a 2-year fellowship. One was a clinical fellowship, and then an additional year to learn how to do clinical research in patients with MS. And so I did that at University of Rochester. After that, moved to Florida for a little bit at Gainesville, University of Florida. And then I've been at Ohio State University for about maybe a little bit over a year. I do a lot of just clinical work, clinical research, and I also do a little bit of education. I run the MS fellowship here at Ohio State University.
Awesome. Awesome. So I had a bit of a similar experience, but I had an amazing mentor, Dr. Mary Hughes, who was my very first inaugural guest on Brain Chat, who really got me interested in MS. And so I think it's so fascinating because everybody is different. And so I like the fact that it's not what we call a cookie cutter disease. And so I can deal with that individual patient on that individual level. And speaking of individuals, I see my good friend Tyler has joined the conversation. So we're going to bring Tyler Campbell up to the stream. We're so excited to have you, Tyler. Awesome. Welcome back to Brain Chat. So you're a Brain Chat veteran.
Listen, the good doctor was laying down her resume. I gotta come with my A game on. I'm bringing up the. You remember that show? You are the weakest link. Goodbye.
No, you are not.
I'm just
Absolutely
messing with you.
not.
It's a pleasure, ladies. It is a pleasure.
Absolutely, absolutely. So we just were talking a little bit about how if we had done a show about Black people with MS, let's say 10 years ago, we wouldn't have anything to talk about. We'd just be like,
Yeah.
okay, we don't know anything. Have a great night. And so, things have come a long way. And so I want to focus a bit more on the advances that have been made and kind of what we still need to understand and where we need to go from here. But first, tell us a little bit about your story. And I understand you have a book. I haven't got my hands on it yet, but it is on the way. So tell us a little bit about your story, Tyler, and how you got into advocacy, as a person living with MS.
Yes, ma'am. I was diagnosed in 2007, December of 2007, while I was attending San Diego State University. I was playing football there, and I was diagnosed. There's no history of the disease whatsoever, and no warning for me as a Black person. You're educated on sickle cell, high blood pressure, high cholesterol, cancer, things of that nature. And so to wake up one morning and not be able to feel the side of your face, have paralysis, slurred speech without warning, that wasn't in my talks with my family growing up. Did not know what that was. And so was diagnosed very quickly within that same year, within a matter of weeks after spinal tap and MRI. And I will never forget it. And this is what led to my advocacy work, was that when I hit Dr. Google, I'm not suggesting everybody go to Dr. Google. I'm not saying that.
Google.
I'm not saying that, Mitzi. I did not know. I was 21 years old. I did not know. But what I saw were people who did not look like me. And that caused me to panic because I felt like, well, nobody else had. I must really have something wrong if this chose me and it didn't choose anybody else in my family. And but also after time, after walking the walk and getting the correct knowledge from organizations that are out there, it became proof to me that it needed to be turned into advocacy work. Right, and that's what prompted the advocacy, because there was no face like mine, and we needed more visibility.
Absolutely. And when we look at statistics, so globally, MS is still considered a disease of people of Northern European descent, right? But when we look at the US, it looks a little bit different, and the face of MS is a lot different than what maybe some of our colleagues across the pond may think about when we think about the face of MS, or even some of our colleagues here, because I remember in med school, we were taught that MS was a young white woman's disease. And so when we look at statistics, especially here in the South in Georgia, if I look at my waiting room, 50 to 60% of my patients are Black. And when we look at several studies, they suggest that the incidence of MS is actually highest in Black people, particularly Black women. And
Mhm.
that was really kind of an eye opening thing for me because I knew that it was what I was seeing, but it wasn't, it hadn't quite caught on everywhere else yet. And so I find it very interesting that now these statistics that, were new maybe 10 years ago are now very routinely kind of quoted in our papers and in our conferences. And so it's become much more well known, but maybe not as well known as it should be. What are your thoughts about that, Dr. Gang?
Yeah, I mean, so that's really interesting. We go to med school, and that was what I learned in med school. If you see a question with a Caucasian woman with acute neurologic symptoms, you instantly think MS. And so I feel like, that association is very strong, and we kind of grow up through our training with that mindset that MS is a disease of that affects white individuals, which the prevalence overall, as you said, is still highest in white individuals. But a lot of the epidemiology data that's coming out now in multiple studies has shown that the incidence is actually highest. And incidence means who are the new people getting MS. We
Hmm.
have kind of everybody that has MS now. Okay, yes, there's more white people with MS than other races, whether it's Black or Hispanics. But when you look at newcomers, who are the people getting MS the most frequently? And, in multiple studies, we've seen it's highest in Black individuals and specifically in Black women. The incidence is highest. And so that picture is changing, but,
Hmm.
the medical community, I don't think has caught up with that data yet. I've had many patients that, come to me and say, I had all these symptoms for all these years, and my doctor said, no, this can't be MS because, you're Black, and it's it's very unlikely, or it's very rare to happen in you because you don't fit the demographic. And so we're still seeing that, in the medical community, that people still instinctively think MS does not affect people that are not white or Caucasians. And, it's just a lot of education to let people know that no, MS affects everybody. And the demographic profile is changing, whereby we're seeing more minorities, whether it's the Hispanic group or African Americans, getting MS and being diagnosed with MS. So I'm really grateful that, Tyler, you're doing a lot of advocacy work just to create that awareness, because somebody with MS may come across you and say, wow, I see somebody like me that, I can look up to and I can reach out to, and I can see the great things that they're doing, because there's that isolation that people feel when they feel like they're all alone and there's nobody like
Hmm.
them that has what they have.
Absolutely. And, another piece is, I kind of think about it kind of like when you get a new car, right? So, whenever someone comes into my office that's newly diagnosed, they say, I don't know any other Black people with MS. How did I get MS? And then by that second visit, they're like, oh, I didn't know my neighbor had it, my cousin, the girl at church, like when you get that new car and nobody has that car. And then as soon as you get it, you see 50 of them riding down the road, right? I
Yeah.
think the other piece is not only is this not known in the scientific community as much as it should be, but also in the general Black community, right? A lot of times we don't talk about different diseases that run in the family. If you say, what runs in your family? It's like, I don't know. They didn't really talk about that. So when you think about diseases like MS, sometimes there's a stigma attached to it. Can you
Mhm.
tell us a little bit about that, Tyler? Like either from your experience or from people that you've interacted with within the community? Talk a little bit about that.
So I still to this day, when people ask me, I tell them I don't believe I'm the first person in my family with MS. I was just the first one to get a diagnosis and to talk about it. I
Mm,
always heard like, that oh, he's just off. You know what I'm
right.
saying? Or they're a little bit off. That person that walked with the limp or was always dragging, and I understand, knowing the background of my family. Obviously, there's a lot of my family comes from rural East Texas, from the country. So there are a lot of instances of poverty. And
Mhm.
obviously getting adequate medical care was not a possibility. So taking all of those things into account, I know beyond a shadow of a doubt that it's not. And the same thing not only happens with us with MS, but it's just disease, mental health, anything in general. I found that from a Black male's perspective, I know it's even more true for women, that when you confess and you open up your mouth about something, that is when we feel more comfortable to say, "Oh, I've heard of that," or "Yes." And it's I think there's just more education. There's a greater sense of awareness that proves our work. That shows why this brain chat is so incredibly important, to break barriers and add a comfort level. Because even though the statistics may be, I often feel like there is more of an understand, not more of an understanding, but there is more about this disease in within our communities than we think. It just haven't gotten a platform for conversation.
Right,
And
right.
I think when we break that platform for conversation, when Doc is on here, when you're on here, people in the chat, and we're conversing and we take this knowledge back out, that's how we do our due diligence for education. And I think that's
Absolutely.
what brings us collectively together, which we have always been notable for in our past.
Absolutely, absolutely. I agree with everything that you said. I think, those conversations have to happen on a broader level, but also happen on an individual level. And, when we talk about kind of advocacy, we talk about outcomes, all of these things are very linked or intertwined, right? Where you get access to information. Do you have access to information? Do you have access to physicians? Do you have access to someone who specializes in MS to see at least once during the point of your journey? All of these things make a difference in what we see on the back end. And so traditionally, when we look at the research and we look at all the evidence we have, everything suggests that we tend to do worse, which is not uncommon. That happens with most diseases, right? Black populations tend to do worse. One of the big issues with MS is this related to something biologic? Is it related to the fact that maybe we just don't have access? We're not getting diagnosed early enough. We're not getting to the doctor, or maybe our symptoms even aren't believed. Talk to us a little bit about that, Dr. Gyang. Kind of what are some of the outcomes that we see in this population, and maybe what are some of the reasons we see some of those things?
Yeah, I mean that's a great question, and I think I'm really excited that people are starting to look at this
Mhm.
because in the past, we just didn't know. And there's a lot of research, or not a lot, but there's more research that's going to look at how MS presents in different demographic groups. From what we see more, from what we've seen more recently, from the research that's been done more recently, some of the clinical features of MS are different in African American and Hispanic populations. For instance, there's data that says, there's a younger onset in these two groups. So they're diagnosed earlier. Some of the clinical outcomes, like, when we look at, the progression of disability, or even when we look at MRI outcomes, when we look at MRI scans and look at the different demographic groups, we see that there's a more rapid decline or more rapid progression in Black people compared to white people. When we even look at OCTs, which are, like a special tool that help us to see the thickness of the retina, we see that there's more rapid thinning in Black people compared to other groups. And so that data is coming out. And as you mentioned, how much of it is biologic versus how much of it is the fact that there's no access to care. There's a lot of, just socioeconomic or social determinants of healthcare that are confounding this data. And so I think more research is needed. More research is needed to look at MS in the different demographic groups, and even to look at how, medications are, how patients respond to medications from the different demographic groups. Look at, why there are certain differences when we look from one demographic group to another. Because I feel it may not just be one reason. Sometimes we just attribute this is a biologic reason. It's because we're different races, but there's just so much that plays into it. When you have one group that has less access to care than another, then maybe there's a confounding factor. If one group, if you have a patient that has had MS and was diagnosed late, of course they're going to be late on treatment, and therefore, of course, they're going to have more disability. And so there's just a lot of things that play into this that is just not possible to say, this is a biologic difference, or this is the one reason why the different groups have this, like a different presentation when we look at large clinical data. And I think as a clinician and as a researcher, that's why I feel we just need more research. We
Yeah.
need more people thinking about this. We need more people, designing trials to try to figure out, why do we see these differences, and how can we help? How can we meet people where they are and help, everybody, to thrive, and not to be more disabled from MS.
Right. And there's a lot of great work that's going on, really focused on this. And really, my aha moment was I was practicing, I was seeing patients every day, and I just got tired of seeing people do poorly. Right. And it was for a variety of reasons. I can't necessarily say, when we look at biology, we are a lot more similar than we are different. Right. And when we talk about race is a social construct. Right. But I just got tired of seeing certain groups do so poorly. And, I realized as I was giving this lecture, I was traveling, giving this great lecture. Everybody's like, yeah, Dr. Williams, you're doing it, you're doing it, you're doing it. And I realized nothing has changed in my whole, the whole time I was practicing. I just kept saying the same thing. And I had new papers that just kept saying the same thing, that people are doing worse. But why are we doing worse? And so I think it's very important to focus on the work that's being done to try to change this perception, to try to figure out what's going on. So let's start a little bit. So, Tyler, let's start a little bit with like your journey in advocacy and the work that you do. And let's talk a little bit about that book. I want to hear a little bit more about that. So tell us about it. Tell
Yes.
the people about
I will.
tell the
So
tell the
I
people.
will- I will tell the people the only reason that the book came to be, and shout out Mitzi. It's an Amazon. It's on the Amazon bestsellers list already. I
Yay.
couldn't
How long?
believe that.
When did you release it?
So it came out on Friday. It's called "The Ball Came Out: Life on the Other Side." And so I was not expecting that. So it's like number 2 in a certain category, and it's in the top 20 for Amazon bestsellers right now. But
Awesome.
the only reason that it was able to get there was because I spent the last year and a half of my life going through therapy.
Mm,
And I recognize that to help my MS, and ease Tyler's stress, there were a lot of conversations that Tyler had never had. Um, in my adolescent years, even before MS even came into the picture in the 20s of my life, there was a lot of baggage that I was bringing along with MS. And I noticed that as I started to work through those things and tough conversations and not hiding things, it made me feel less stressful. And I really got to know me. I feel like for like the very first time in my life since I was about 11 years old.
wow.
So I wrote the book as a means for my overall health and the ability to breathe and decompress. And I noticed that over the last year, it's the best I've ever felt because I started
Mm,
journalizing my feelings over a year. I started freeing my mind over a year, which as a result actually helped me just feel better about who I saw in the mirror. Um,
mm,
and I didn't understand how much of a role that played in my overall approach to multiple sclerosis. I'm 35 now, so I've been living with it for 14 years of my life, and it just the ability to be open. We need all the help that we can get when fighting this disease. We're putting
yeah.
out so many different fires all the time. um, I found that this really helped me. And it wasn't necessarily the outlet that was always put in front of me first, with medications, and we knew we need those therapies. But Mitzi, I never really got a chance to speak to somebody about what the overall diving into yourself and your personal life and freeing yourself from some things that happened in your adolescence, that happened on your job, that happened in your life, these different events, how we never addressed them. And that's such a common, not just thing in our community, it's for people as a whole that I've learned. And that was my encouraging thing that helped me to kind of approach and tackle this disease in a different way. over the last year and a half of my
I
life.
love that. Now, see, every time you come over here, we start preaching. So let's put a pin in that right there.
Yeah.
So, thinking about that mind body connection, right? Especially, we have this thought sometimes that wellness, overall wellness, and health and science don't necessarily go together, right? So when people talk to me about a healthy approach to their MS, I'm like, okay, absolutely. Let's drink the water. Let's go see the counselor. Let's do all the things. But that doesn't necessarily mean we don't also incorporate the scientific part. One of the things that has been amazing, and it's difficult to explain if someone hasn't um, been, in the MS community for a long time. But I remember a time where we only had a couple of choices of what we could do, and it was like, if we put you on the low dose of this and it didn't work, we put you on a high dose of the same thing, and it might not make you feel so good. And so there's so many different options and so many different ways we can work together to achieve overall wellness. But at the same time, we recognize that medication is not the overall only fix for treating MS, that we also have to look at the whole person. We have to deal with those stressors, right? We have to deal with those mental things. Sometimes developing a disease like MS could, kind of stop you in your tracks and make you reevaluate and start to work on some of those things. But if we don't deal with the other stuff, there's no medication I can give you that'll fix all of the issues that we have going on.
I
What are
know
your
that's right.
thoughts? Yeah, go ahead. What do you want to say about that? Or either Dr. Gyang, anything you want to add about that?
Let the doctor go ahead and chime in because I know she's itching too, Mitzi. Let her chime in. Let her chime in. I can tell.
Right.
No, I mean, I just love what you said, Tyler. You went to therapy and just found yourself and just released a lot. And I think, I can't underemphasize how, I can't overemphasize how important that mental health is. As a physician, there was a book I read a few years ago that really, really helped me understand this. And the name of the book is The Body Keeps the Score. And it's by a psychiatrist who talks about how the events we go through in life keeps there's something that is in that remains in our body.
Mm,
You may go through a lot in life and you feel like, okay, I'm done with that. I've dealt with it and I've moved on. But the premise of this book is there's a mark or there's a score. Your body's like keeping score, and it gets to a certain point where you start to manifest, whether it's depression, whether it's anxiety, and sometimes even physical conditions. I mean, there were so many studies that were done that even showed, you know, inflammatory markers were higher in people that had a lot of trauma in their past or that
mm,
had a lot of unresolved issues. And I just feel like, I talk to all my patients about the fact that we all need therapy. Like, sometimes you talk about it and people feel, no, I don't want to see a psychiatrist. Like, that sounds like something that, somebody that's unstable should do. But we all need therapy. Like, we all have been through life. Life kind of throws a lot of curveballs at us. And we all need an outlet of processing those feelings, processing those emotions, and just letting them out in a way that it doesn't affect us or our body doesn't keep that score that
right.
ends up blowing up in the future. And so I just
Absolutely.
really, really love that, you went through therapy and you kind of just found such a great you responded so well, to it. And I tell patients, if you try one person and it doesn't work out, try somebody else. Sometimes it's a matter of just finding the person that fits. A lot of MS care is non-pharmacologic. We emphasize on the disease modifying treatments, but we have to couple that with whether it's physical therapy, whether it's psychotherapy, exercise, bonding with other people around you. There's just so much that goes into being a healthy person than taking a pill or, you know, just seeing your doctor. So, I'm just so glad that you had that experience and you I'm excited to read your book. Like you just talking about it makes me feel like yes, I that's a book that I would really like to read. Yes, so that's what I have to
Absolutely.
say. Yeah.
Absolutely.
Hey,
Therapy
Mitzi,
is so important. Listen,
let me
man. Now we
let me say this, Mitzi.
okay,
Let
go
me
ahead.
say
Go
this
ahead. Go ahead.
because
Go ahead.
because for people, somebody saying no, not me, right? We don't do that. There was a study done on Holocaust survivors, okay, and the more susceptible to diseases as the lineage went on from the trauma experienced by those survivors and what the generations below were more susceptible to. We all have something. Imagine with us as people, with slavery being what it is in this country, if you don't feel like you come from some form of trauma, it's in your history and it's in your genetic makeup. So it is worth you taking the time to
Right.
check in and discover yourself. Go ahead, Mitzi. Keep going.
Absolutely. Listen, man. So listen, we could talk about therapy all day, and the thing that's so important is, you know, i- there are all kinds of things that we can do to enhance our mental health, right? So I'm a big advocate of therapy, especially when someone is diagnosed or when someone goes through a transition, because you have regular life on top of, a chronic condition. I'm a big advocate of mindfulness, right? Meditation, all of these things that, I didn't necessarily grow up hearing. Absolutely prayer, right? We know that religion and spirituality is very big in the Black community. These things help, but, listen, pray and meditate, pray and see a counselor, right? Things are not mutually exclusive. And, we all intuitively know that when we're more stressed, we have more symptoms. But I think that it's often taking that next step to see how can we actively decrease the stress and looking at our mental health as just as important as, our cardiovascular health. I tell someone, if your chest is hurting, you're not going to sit there and say it's going to go away. You're going to go to the hospital, right? But when our minds are overburdened, we say, oh, I'll be all right. I'm just gonna go take a nap. I'm gonna go to sleep. And when I wake up, it's gonna magically go away. And it doesn't work like that. We have to prioritize mental health just as much as we prioritize our physical health in other ways. So, thinking about, looking at things like the mind body connection, I'm very excited that there is more work focused on this. Again, one of those areas where if you had asked 10 years ago and said, what kind of diet should I do? What about mindfulness? We'd be like, yeah, we don't have any research for that. I can tell you what I did. You know, in turn, there's also a lot of research focused on looking at MS holistically and looking at increasing diversity in our clinical research. Are there any things, for instance, Dr. Gyang just did organized this amazing neurotherapeutic symposium. It sounds really smart because it is really smart. Just talking about different ways to look at clinical trials, the way we design them. Because if we want to affect outcomes, right, and figure out on the back end, we have to go all the way back to the science, right? Before we have these therapies, it was a molecule somewhere and somebody was in a lab, trying to figure out how this works or how that works. And so tell us a little bit about some of the work that's been done and tell us about that amazing symposium that you just had recently.
Yeah, no, thank you. And Dr. Williams was part of the symposium, and it was just really great having you there. So, I mean, the main concept of this event was driven by exactly what we're talking about. So in medicine, we have a lot of disparities when we look at treatment outcomes, this like, clinical outcomes, and it's like, these groups of people are not doing as great versus these groups of people, or, there's inadequate access to services or medications in specific demographic groups. And so basically we sat down and said, where does this start? Right? If you design a trial, or when you're thinking about a medication and you're thinking about could this be helpful in MS, and you're not intentional about how do we see how this drug works in different demographics, how do we see how this is going to play out in the future so that everybody is able to get access to the medication, if we're not intentionally thinking about that from the foundation, of course, when the drug comes out, we're going to see that there's disparities. There's some groups of people are not having access, some groups are. And so basically the concept of the event was, how do we incorporate diversity and equity into research? Meaning, before the drug goes into the market, while you're still in the office, having a meeting, planning the design of the trial, or in the lab, working with mice or working with whatever you're working with, how do you keep that in mind? That, we have certain disparities, we have certain differences in clinical outcomes, and how is the research you're doing or the clinical trial you're designing, how do you incorporate diversity, how do you incorporate equity into that research? And we felt like was a better way to take it than to let that process go out, and then you're on the other end where the drug is out, and of course there's a lot of disparities, and you're trying to fix those disparities at the tail end of the process. And so we kind of just invited people from all over the country, a few people from other countries, to just talk about, you know how have we gotten to where we are, some of the things that have happened in medicine and some of the ideas we have, can we challenge them a little bit? There's just a lot of talks about thinking about, some of the basic normal levels that we have for certain, whether it's certain functions that we do in medicine, and there's a difference between blacks and whites. How did that come about? Why is there that difference between, if we look at our labs, kidney function is different in blacks versus in white people. How did that start? And that just kind of helps us to go down to the roots of, are we really thinking about these concepts from the foundation and, addressing them, or are we just kind of looking at the tail end and saying, how do we fix this problem, because we see that there's a lot of disparities in outcomes? And so basically we had just, it was just such an informative session with just multiple people talking about how to start thinking about diversity, whether you're in the lab, whether you're designing a clinical trial. We had people from industry, from the pharmaceutical companies. We had a lot of researchers. We had people from the NIH. We had people from just kind of leaders from all over. And that was a discussion to say, let's think about this. Do we need to design special trials, for instance, for patients from a specific demographic with MS? Because no matter how many, even if we have the same proportion of the community, with MS in a clinical trial, we're 13% of the population. So we're still going to be a low number compared to other demographics. So should we do special trials specific in certain demographics, because they're always going to be underpowered in a study just because we don't have enough of them in the community. So there was just a lot of discussion like that, and it was just wonderful. And I'm happy that we were able to do this event, because I feel it creates that awareness and it makes other people think differently about research, about clinical trials, about clinical care, and thinking about, how do I incorporate that equity focus in everything that I do, and being intentional about it.
Yeah, I love that. And the two things that I hear kind of coming out of what you're saying is, making sure that we have a seat at the table, right? Not only that we are focused on, increasing diversity, right? Not just because, we don't want it to be like we want more black people to be in research so they can be guinea pigs or anything like that, but really so that you have equal access to the same resources, right? Because there's a lot of great care that goes on in clinical research. There are a lot of different ways to be involved in research, whether it's a questionnaire, whether it's a survey, whether it's a registry, and then the other thing is that, we want to make sure that we are thinking broadly or thinking about health equity from the ground up, right? And not having it as an afterthought. So, a lot of times I get called in and say, hey, we did this trial, Dr. Mitzi. How can we make it more diverse? And it's like, well, everything's done. So I don't know how, I mean, it's done. I don't know what I'm supposed to do, you know. And there are some things that we can do on the back end, but it's always better if we think about it from the front end. And not only that, but including the voice of the people who will be involved, right? As we think about trials moving forward, as we think about research, as we think about making any advance in the community, we have to ask the people in the community, you know what's needed, what type of studies should we be doing, right? So that we're not just focused on our scientific questions, but we're also focused on things that will help people in their everyday life, like studies focused on diet or mindfulness or meditation, or what type of practices will help people to live better, right? Because the whole goal of all of it is so that people live better, and that they come see me and have what I call social visits, right? Where we talk about your kids, we talk about your MS for 2 minutes, and then we talk about everything else that you're doing, living your best life, right? So that's the goal. We want everybody to live better. Now, let's talk a little bit about where do we go from here? So what's still needed? So we're coming up toward the end here. And if anyone has any questions, I will take a pause for the cause. You can put them in the chat. I see somebody made a great comment about therapy, how it keeps them mentally and emotionally balanced while living life on their terms, which is awesome. And so, if you have any questions, please feel free to put them in the chat. But let's just take a few minutes as we're kind of winding up here to say, what are the next steps? Where do we go from here? And what are you excited about?
Can I say something?
Yes.
I'm really happy, Missy, because the more and more I've been a part and being able to serve and to be around amazing ladies like yourselves, it sounds like there's a greater advancement even since the last year I was here. And I feel like that's the encouraging thing that I hope people are paying attention to, even as it comes to the whole trial discussion and hearing about symposiums that have been put together. The more things like this are pushing the needle for us, that greater level of inclusion. So although we as patients or everybody listening, they might not know it, but things like this are changing the way we are handled as people. And so I hope that is encouraging enough to let people know that there is some form of shift and some form of movement towards being on the right side of right. That's what my grandma used to say. She used to say, Tyler, just be on the right side of right so you never go wrong. There are things that are going to put us on the right side of right within our healthcare system to encourage people to bridge the gap for some level of trust. You all talked about the level of the medications and the inclusion and how, we can change. How do we know that things are going to work better for our bodies? I just feel encouraged. I hope other people listening in are too, because they've been listening to you like I am, that needles are moving somewhat for us as people. And that's the hope that I hope people are clinging to that have our disease.
No,
Absolutely.
you said it so beautifully, Tyler. And I think it's, as Dr. Williams said, having a voice, having a place on the table. You just published a book about, your experience with MS, and it's just everybody being aware that you can make a change. You have the ability to not just shape your own, life and your own destiny, but help other people. If there's anything anyone would pick today is consider therapy. It changes lives. But I always want my patients to be empowered, because I feel like a lot of times there's a lot of helplessness that comes with this disease, where people are just in a place where they don't know that there's things that could help. They don't know that there's resources out there that could make life better, and it's kind of just like, this is what it is, and I don't want to do anything else. I just want to, yeah. So we need to empower people around us, and that's why, like, what Tyler's doing in terms of advocacy, this, the nerdy neurologist, event that goes on. I mean, this is just very empowering for people to listen to and know that you could go to your doctor and ask about, is there any research that's available that, I could be part of? Or you could find a support group or other people that have MS and connect with them and just learn so much. There's a lot of just education, really valuable education about MS. So I would say, if you empower yourself with solid information. There's a lot of resources out there. And to all the doctors and the clinicians and to the researchers, this is the time to just think out of the box and to do just awesome, great things where we get to understand this disease a lot more and we get to help more people and help to just reduce some of those disparities that we see.
Awesome. Well, listen, I don't know what I could add to that. I mean, y'all preached the whole sermon. I'm going to pass the offering bucket. I mean, this has been an amazing conversation. I think the piece that I would add, to people out there, who may be newly diagnosed or going through a difficult time with their MS is it's important to know that you are not alone. I think one of the things I have said to so many of my patients, especially I have a young Black woman who come in to the office, she'd be very distressed, trying to work and do everything. And I would say, I promise I have 20 other people just like you. You just haven't met them yet. But I promise that there are other people who are going through the same things that you're going through, who maybe have overcome them or maybe are on the other end, that either you could help or could help you. And so I would just say that, as we are putting new faces to the journey with MS, I think it's important for people to know that there are so many others out there who are dealing with or have been through the same things. And that I'm very encouraged for the future. There's a lot of great work that's going on, symposium, conversations that we wouldn't have even been able to fund a a whole conference about. So this is a very exciting time, and I would encourage people to throw your hat in the ring, get involved in advocacy, whether it's telling your story or whether it's working in your local community, whether you want to work with the society. All of these things are extremely important and will help everyone to live well with MS. So I don't think we have any questions in the chat tonight, but this has been an amazing discussion. I want to say thank you so much to Dr. Gyang. Thank you so much to Tyler, for logging in and having this discussion with me on Brain Chat, on this first Brain Chat of Black History Month this year. And I also want to say thank you to our sponsor, Janssen, for sponsoring our podcast. And also, please subscribe to the podcast. So, this is a Facebook Live that lives on YouTube for blackdoctor.org, as well as Dr. Mitzi Joy, MD. But it also is a podcast. If you look up Brain Chat with the Nerdy Neurologist on Spotify, Apple Podcasts, all of that stuff, tell your mama, tell your cousin, tell your auntie, go subscribe to Brain Chat so we can keep bringing this information to the community and hopefully bringing value to this conversation about MS. So thank you all. We will see you in 2 weeks. We will be talking about the National African American MS Registry with more of my super friends. And I hope everyone has an amazing night.